The body is organized into several cavities or open spaces, and these open spaces are protected by your musculoskeletal system for the most part and contain lots of different organs. Before we talk about the body cavities themselves, it's important to understand the division of the axial and appendicular skeleton. The axial skeleton occurs right down the middle or the axis of your body. It includes your head, your neck, and your trunk, which is made up of the spine and the ribs. The appendicular skeleton is made up of your upper and lower limbs, so your arms including your shoulders and your legs including your hips. The major body cavities that we're going to talk about are found within the axial skeleton. In fact, the axial skeleton provides a good deal of protection from your major organs. So these are the major body cavities that we're going to talk about. You have your cranial cavity, vertebral canal, thoracic cavity, and the abdominal pelvic cavity, which can be further divided into the abdominal cavity and the pelvic cavity as seen in this diagram. The diaphragm is an important muscle. It's used in breathing, and it separates the thoracic cavity from the abdominal pelvic cavity. And you can see it right here in this side view of the cavities. The cranial cavity is a hollow space. It's protected on all sides by the skull, and the thing that's being protected is the brain. So your brain sits inside this hollow space within your skull, surrounded by bone on all sides. The vertebral canal, which can also be called the spinal canal, is a hollow tunnel that's formed by the vertebrae. So if you look at the picture all the way over here, you can see this is an overhead view or superior view of a vertebrae. It has this body, which is a hard bony part. It's got bone all around here forming an arch, and then here is an open space. When you stack these vertebrae like this, you get a big long tunnel called the vertebral canal. And so the vertebral canal is formed, this big tunnel is formed by each of these little openings. So you can see here, it runs all the way from your brain down into your hips. Next, we have the thoracic cavity. The thoracic cavity is bordered by skin, muscles, and bones. Primarily, we're talking about the ribs, though the spine does also protect it in the back a little bit as well. You can see that the diaphragm is right here, and so that's going to separate this thoracic cavity from the abdominal cavity. The thoracic cavity contains the lungs, the heart, the esophagus, part of the esophagus, part of the trachea, and the thymus. Additionally, you can see I put everything except for the lungs into this dashed box. The organs listed in the dashed box are also in the mediastinum, or the mediastinum. It's a smaller cavity that's in the center of the thoracic cavity. And so this mediastinum contains the heart, the esophagus, the trachea, and the thymus. Next, we have the abdominopelvic cavity. The abdominopelvic cavity gets its name because it's made up of the abdominal and the pelvic cavities. And the reason it can be called one cavity is because, unlike the thoracic cavity, there's no real dividing line between the abdominal cavity and the pelvic cavity. There's no diaphragm or other type of organ or membrane that really separates the two. They kind of merge into one. The organs in this cavity are called viscera. So we'll talk about the two parts of the abdominopelvic cavity. The abdominal cavity is the upper portion of the abdominopelvic cavity. It sits in between the thoracic and the pelvic cavities. Again, on that superior part, it's divided from the thoracic cavity by the diaphragm. It's surrounded by skin, a little bit by bones, and mostly by muscles. The abdominal cavity contains many of your organs, specifically many of your digestive organs, including the stomach, the liver, spleen, gallbladder, kidneys, most of the small and large intestine. When we look at these subdivisions of the abdomen, I included these just so we can see how some of our anatomical terms are used. So, for example, right in the middle, we have our our umbilical region of the abdominal cavity, and this is right around your belly button or your umbilical. You have the right and the left lateral regions. Take note that because we're looking at this diagram from the anterior, from the front, the left of this person is on our right and the right is on our left. We have the two inguinal regions as well. Those, as we know from our regional terms, are the groin area. Another way that the abdomen is divided is into quadrants. So we have the right and the left, upper and lower quadrants. These become important because when you're trying to diagnose some sort of internal organ injury, pain, dysfunction, it can be really important, or it is really important, to know what is in each of these quadrants. And so we often talk about right upper abdominal pain, lower left abdominal pain. And by knowing what is in those quadrants, we're able to help narrow down what tests may need to be done. So moving on from the abdominal cavity, we have the pelvic cavity. The pelvic cavity is the lower portion of the abdominopelvic cavity, highlighted in green on this diagram, and it's primarily surrounded by skin and some muscle, enclosed by the hip bones on the inferior or lower end. It contains the end of the large intestine. Remember, most of the large intestine was in the abdominal cavity. It contains the bladder as well as the internal reproductive organs. Again, if we look at the cavities, you have an anterior or front view and a lateral or side view. You can see you have the cranial cavity, the vertebral canal goes right down the back, the thoracic cavity in red with the mediastinum in the dashed line in the middle on this left diagram. You then have the abdominopelvic cavity, which is here in blue and green overlapping, the blue being the abdominal and the green being the pelvic cavity. Lastly, we have some smaller cavities in the head. So of course we have the cranial cavity that takes up most of our head space with our brain, but we do have 4 other cavities that I'd like to talk about. We have the oral cavity, which is essential for lots of things, but digestion especially, contains the teeth and the tongue. We have the nasal cavity, which is essential for breathing. It's divided into right and left halves by the nasal septum. Sometimes this nasal septum can be deviated, so it can be off to one side or another, whether through the way you were born or through injury, like breaking your nose. And sinuses, or other open hollow spaces in your head, connect to the nasal cavity. Then we have our orbital cavities, one on each side. These contain the eyes, as well as the muscles and the nerves that move the eyes. And lastly, we have the middle ear cavities. The middle ear cavities contain the middle ear bones, or the ossicles, and these cavities are essential both for hearing as well as for balance.